to another episode of The Outdoor Woman with me, Nisha PS. Everybody's wondering what will happen after the lockdown period ends, that is after April 14th. And everyone is also eagerly waiting for the next speech of Narendra Modi to the nation to see if he mentions anything about the lockdown extension, or will it be extended selectively, or will something else happen. Nobody actually knows what will happen. It entirely depends on the number of COVID-19 cases by then and the decision of the government. But to help us get some idea, the government has released a containment plan for large outbreaks. It is in the Ministry of Health and Family Welfare website. You can see the entire PDF there. The Cabinet Secretary, who is heading the National Crisis Management Committee, and the advisor to Prime Minister both have said that this is a good model to follow. That plan gives us an indication that a country as large as India cannot be kept under lockdown forever. So, what is this containment plan? Before understanding this, we must understand where this is coming from. Bhilwara model is the core idea behind the containment plan. For those who don't know what that is, Bhilwara in Rajasthan is one of the early hotspots of the COVID-19 outbreak in India. The government responded with extraordinary and aggressive measures, and Bhilwara model refers to the steps taken by the administration in Bhilwara district to contain the disease. The measures taken by the Rajasthan government includes imposing a curfew in the district, which also barred essential services, extensive screening and house-to-house surveys to check for possible cases, and detailed contact tracing of each positive case so as to create a document on everybody they met ever since they got infected. So, what are the components of Bhilwara model? It has 6 elements: isolating the district, mapping the hotspot, door-to-door screening, aggressive contact tracing, which means to track down all those who have come in contact with the infected person, ramping up quarantine and isolation, and monitoring rural areas. So, when number of cases started to increase in this particular district, all those 6 elements were implemented. To be exact, the Bhilwara model was implemented on March 20th, that is 4 days before the national lockdown. And on April 2nd, the district was completely sealed. So, the first lockdown was implemented using 144 and the second one was implemented using the epidemic and disaster management laws. Survey teams were set up and they found 6 hotspots in the city, and nearly 30 lakhs people were tested for influenza-like symptoms, and they were followed up twice a day. Then quarantine facilities were made. In a district like Bhilwara with a population of roughly 30 to 35 lakhs, making quarantine facilities is a challenge. So what the government did was, it took over few private hospitals and hotels. To be exact, the Rajasthani government took over 4 private hospitals with 25 beds each and 27 hotels with 1,541 rooms, and they were taken over and used for isolating those who seem likely to be carrying the virus. In addition to people quarantined in health centers, 7,620 people were home quarantined. They were also monitored twice a day. Unlike what we see in Tamil Nadu as a part of the lockdown, all the shops were closed and the government supplied essential items, including cooked food. This is something which could be done for a district or few zones, but not an entire country. So, that is the difference between a containment policy for a hotspot and an entire country. The aggressive containment plan released by the Health Ministry includes sealing off buffer zones for nearly a month. The government made the containment plan after clusters posing high risk of further spread of COVID-19 emerged in several states. The number of districts that reported COVID-19 cases has increased 3 times since March 22nd, which led the government to come up with this containment plan. The 20-page document says that the aggressive containment strategy will be scaled down only if no new cases of COVID-19 are reported for at least 4 weeks after the last confirmed case. Some of the steps the government seeks to take includes sealing containment areas and stopping movement of people in and out of these areas. All suspect and confirmed COVID-19 cases will be hospitalized and kept in isolation in hospitals dedicated to fighting the coronavirus. Patients will be discharged only if 2 samples test negative for coronavirus. Those with mild symptoms will be quarantined in stadiums. Those having moderate symptoms will be admitted to hospitals meant for COVID-19 care, and those with severe symptoms will be sent to a tertiary or advanced hospitals. Another step mentioned in the strategy is closure of schools, colleges and offices in containment and buffer zones. There will be no public and private transport in these areas. Only essential services will be allowed to move. The Health Ministry document says that the geographic distribution of COVID-19 is somewhat similar to the distribution of H1N1 pandemic. While the spread of COVID-19 in the population could be high, it is unlikely that it will uniformly affect all parts of the country. This calls for differential approach to different regions of the country while mounting a strong containment effort in hotspots. This is called geographic quarantine. Large-scale measures to contain COVID-19 over large territories have been tried in China. Mathematical modeling studies have suggested that containment might be possible, especially when other public health sectors are combined with an effective social distancing strategy. At all times, doctors, nurses and paramedics working in clinical areas will wear 3-layered surgical mask and gloves. This document released by the Union Health Ministry also says about the laws available under the Disaster Management Act of 2005 and Epidemic Diseases Act of 1897, and the document also has details about various authorities who are in charge and where to report about the positive cases, what to do when there is a sudden increase of positive patients in a particular area, how to dispose the medical wastes, etc. One other important point that I thought that I should share with you is that in a country like India, it is not possible to test samples of everyone. So many test kits are not available. Global supplies on even common drugs are running dangerously low. Even America recently asked India's help on that front. So, extensive measures will be implemented all over India to contain the virus and prevent more loss. And only if there are no COVID-19 cases for 4 weeks in a particular region or zone, normalcy will be declared. This means that different parts of the country will be declared COVID-free at different timelines. We all know the status of our state when it comes to the number of COVID-19 cases. So, we can assess a little where do we stand when it comes to normalcy. Thank you for the support. Stay connected for more such updates. This is Nisha PS.